This is a video on how to remove an umbilical catheter. First, you're going to make sure that there's an order in Epic stating which catheter is to be pulled, whether it's an umbilical venous catheter or umbilical arterial catheter. You're then going to check in the procedure notes for the line placement and insertion depth. And then you are also going to confirm with the nurse that the fluids have been off for at least 15 minutes prior to line removal. Then I'm going to gather my necessary supplies. I'm going to gather a suture removal kit, which you sometimes don't need, sometimes do. I've already washed my hands and I've already donned my standard PPE. I'm going to begin by looking at the suture. In this baby, we can see that it is sutured at 6 centimeters. So there's the 8, 7, 6, and then the sutures are already fairly loose. In some cases, you'll need to use an umbilical or an alcohol swab to help loosen the sutures. And I just grab my swab and kind of drape it over and just sort of rub it back and forth like so. This just helps loosen the sutures. You can do this for as long as you need to, just to make sure that the sutures are nice and loose prior to line removal. And voila, the sutures are nice and loose. You can also use wet gauze if the alcohol swab doesn't seem like it's enough. Then I'm going to carefully just kind of slip my line out like so, and I go every 1 centimeter every 30 seconds. And this is just to allow and ensure that there is adequate hemostasis in the line so that it reduces the amount of bleeding that can happen after the line is removed. So I'm just gonna keep pulling out. Should you need to use scissors to help get rid of the sutures if they're too tight, I'll just show you how to troubleshoot that right now. You can sometimes use a tweezer to kind of help pull the lines apart to create more space between the line and the suture to help make line removal easier. If you need to cut, just be very careful because you don't want to accidentally cut the umbilical cord. So always just make sure you're cutting away from the line to ensure that you're not then cutting the umbilical cord. And you can pull the rest of the line out. Then you want to make sure you inspect the catheter tip to make sure it is intact and that the full 7 centimeters has indeed been removed, in which case for this baby it has. I'm then going to carefully use my alcohol swab again and undo the tegaderm. And then you can discard and remove the line. Oh, and sometimes if there is oozing, you can use the gauze that's in the suture removal kit to help with hemostasis on the cord. If it's in a venous catheter, you want to hold pressure right on top of the line or the stump until bleeding stops. If it's an arterial catheter, sometimes you'll hold below, because that's where the vessel comes in, and just put light pressure right below the umbilicus to help with the bleeding. You want to hold pressure until there is no oozing visible, and make sure that you've watched the cord for at least 1 full minute without any oozing. If there was oozing in the first place, maybe watch it for more like 5 minutes just to make sure that there isn't going to be any kind of blood loss after the procedure. And then you'll write your procedure note in Epic, documenting the line removal, and communicate to the nurse that the line has successfully been removed.